This is Rogers TV, New Brunswick.
Do you worry about how much someone drinks?
Do you feel angry or depressed most of the time? Do you feel neglected or unloved?
Do you feel that if the drinker loved you, she or he would stop drinking?
If you answered yes to any of these questions, you are not alone.
Not everyone trapped by alcohol is an alcoholic.
Families and friends are suffering too.
Al-Anon and
Alateen can help. Call 1-866-200-0223 or visit alanon.org/help.
Are you the type who would keep going or stop? It's not easy to stop when you have an addiction. Legalizing cannabis won't stop addiction. It trivializes its consumption. Let's be vigilant. If you need help, visit portage.ca.
This is Rogers TV, Fredericton. We interrupt our regularly scheduled programming in order to bring you the following special presentation.
Today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. La porte-parole aujourd'hui est le médecin hygiéniste en chef, le Dr. Jennifer Russell. Speaking on behalf of the province today is Dr. Jennifer Russell, the province's Chief Medical Officer of Health. Dr. Russell.
Thank you, Bruce. Merci. Good afternoon, everyone. Bonjour. Au cours des 2 dernières semaines, le Nouveau-Brunswick a bénéficié d'un répit en ce qui concerne les nouveaux cas confirmés de COVID-19. Nous avons toutefois poursuivi nos recherches afin de repérer de nouveaux cas, car nous savions que nous allions en trouver. J'annonce aujourd'hui que nous avons un nouveau cas confirmé de COVID-19, notre premier depuis le 18 avril. Il s'agit d'une personne âgée de 30 à 39 ans dans la zone 3, la région de Fredericton. Nous nous attendions à cette situation et nous nous y sommes préparés. For the past 2 weeks, New Brunswick has enjoyed a respite from new confirmed cases of COVID-19. But we never stopped looking for new cases because we knew that eventually we would find them. So today we have a new confirmed case of COVID-19, our first case since April 18th. This individual is age 30 to 39 in Zone 3, the Fredericton region. The source of the infection is currently under investigation, so I can't say today whether it's community transmission or travel related, so we're looking into it. And we have been expecting this, and we have been preparing for it. Finding a new case is not a failure on anyone's part. It means that our surveillance system is working, and it is a sign of success. This is part of our new normal. New cases will appear, and when they do, we will take aggressive steps to isolate them and track down those that they have been in contact with. And obviously, if people are maintaining 6 feet of distance between each other and they're staying within their bubble, then obviously the number of close contacts will hopefully be very, very small. So we will use our testing capacity to ensure we limit a larger outbreak in the region. The case I'm reporting on today is totally separate from the notification issued last evening regarding a person with COVID-19 who traveled to Moncton on WestJet Flight 3456 on Monday, April 27th. And that individual was not tested for COVID-19 in New Brunswick. As soon as we were made aware of this incident, we took immediate steps to inform New Brunswickers. We have determined that the individual in question landed in Moncton, and we understand that this person is in another province. But we are confirming with other jurisdictions the individual's whereabouts. My team is reaching out to federal colleagues to acquire information and discuss what can be done to try to reduce the risk of this happening again. Any person who was on WestJet Flight 3456 on April 27th is directed to self-isolate and contact Telecare 811 or their primary health care provider if symptoms develop. And obviously, anybody coming into the province should be self-isolating already. So if anybody develops symptoms who was on that flight, you should call 811 and get tested. This is a timely reminder that COVID-19 is with us here in New Brunswick, as well as in provinces and states that surround us. Le cas que j'annonce aujourd'hui n'a pas de lien avec l'avis émis hier soir concernant une personne ayant contracté la COVID-19 qui a pris le vol 3456 de WestJet à destination de Moncton le lundi 27 avril dernier. Cette personne n'a pas subi un test de dépistage de la COVID-19 au Nouveau-Brunswick. Toute personne qui prenait place à bord du vol 3456 de WestJet le 27 avril est tenue de s'isoler et d'appeler Télésoins 811 ou son fournisseur de soins de santé primaire si elle présente des symptômes. Ce nouveau cas nous rappelle que le COVID-19 est parmi nous au Nouveau-Brunswick, mais qu'elle est aussi présente dans les provinces et les États qui nous entourent. We must be ready to address new cases when they emerge, as this happened today, and continue to do the things that will slow down the spread of the virus. That means continuing to stay home within your 2-household bubble as much as possible. When you do go out, remember to maintain 2 meters of physical distancing between yourself and others. When that is difficult, I strongly recommend that you wear a community face mask that covers your mouth and nose. This will protect others if you have unknowingly come into contact with the virus. And remember to wash your hands regularly and thoroughly and avoid touching your face and cough into your elbow if you're not wearing a mask. Clean commonly touched surfaces in your home, such as doorknobs and countertops. These actions must become part of our new normal because they will save lives. Your actions have given us the precious gift of time to prepare, to plan, and execute our strategy. Les mesures que vous avez prises nous ont donné du temps précieux, du temps pour nous préparer, du temps pour planifier et du temps pour mettre notre stratégie en œuvre. Ne vous découragez pas. La meilleure mesure du succès n'est pas l'absence de cas, mais plutôt l'efficacité avec laquelle nous intervenons lorsque de nouveaux cas sont signalés. Don't be discouraged. The best measure of success is not an absence of new cases, but how effectively we respond when new cases emerge. And the only way we can find new cases is for as many people as possible to get tested. So if you have 2 symptoms that are on the long list that we have now, call 811 and get tested or go to your primary care provider. Until a vaccine or other treatment for COVID-19 becomes widely available, this is how it must be. COVID-19 will not stop us from living our lives, but we must respect its presence and do all we can to continue to slow its progress through our province. We will not stop moving forward, but we will look both ways before stepping into traffic. Thank you very much. Merci.
Why don't you grab a drink of water while I start it off?
We will now proceed with questions from the members of the media. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Mike Cameron, CTV.
Thank you, Bruce. Dr. Russell, I wonder if you could provide more information about this flight for example, how many passengers were on the WestJet flight? Is it the responsibility of New Brunswick Health Department to contact each of the other passengers and order them to self-isolate? And if you know which province this passenger in question was destined for, was PEI or Nova Scotia or somewhere else? Thank you.
So these are all very good questions, and I wish I had the answers to all of them. I can tell you how I would like and hope to see things happen, and we're definitely going to be looking into the processes. My understanding right now is that whenever there is a positive case, that there is the website with Public Health Agency of Canada has a list of flights where they have positive cases, and that information then gets transmitted to the airline. The airline then notifies the airport, and again, through that process, obviously public health should be involved at some point along the way. Usually it's either the province where they were tested or their destination province. So as far as I am aware, that person was tested in a province that wasn't New Brunswick, obviously, because we would have known about that, and they actually obviously weren't doing the contact tracing here. There's a feedback there. I'm not sure what that is.
Can everybody mute their microphones because we are getting feedback?
TV.
It's TV. Merci beaucoup. Continue, doctor.
Sorry, there was a lot of feedback and I couldn't hear anything. So the short answer is that the province where the person was tested would be notifying the patient and doing the contact tracing from there. We have had situations before where we did get notified about a flight, but we didn't have the names or contact information of people, and so that's why we announced it publicly. So again, I feel there are some gaps here that we're exploring, and I have many staff looking into this right now, and we've been making a lot of phone calls, and so we hope that this doesn't happen again. So that's why we're really exploring what the processes are and should be that would make sure that we have everything covered in terms of what public health measures are supposed to be in place and what people should be doing. So I'll be talking to my colleagues about this, and I guess the thing is that the airlines, the requirements now for air travel include wearing a facial mask. There's extensive screening that happens now before you get on a flight in terms of questions, and this kind of screening happens before the person gets on the plane, and then now at our airport since April 25th, we have DPS staff there also screening passengers as they come off the flights. So we do have quite a bit of information at this point, but there's some more work that has to be done for clarification on that. Everybody coming into the province needs to self-isolate for 14 days. That's a given. And obviously, if people are staying within their 2-household bubble and they are self-isolating as recommended, then obviously the risk to other folks in public is minimized at this point in time with all the measures that we have in place.
Thank you, Dr. Mike. Do you have the quickest follow-up?
I'll have a quick follow-up, but Doctor, both you and the Premier in recent days have spoken at length about the area, the risk at our borders, and I wonder if this is an indication of just how porous our borders really are. If we have limited control of who arrives in New Brunswick, perhaps COVID positive.
I hear what you're saying, and honestly, we've had several meetings in the last week around how can we tighten things up, how can we make things very clear and definitive so that we can make sure that our borders are not as porous as they are right now. So I do agree with you, and the Premier and I are both on the same page in that we definitely want to make sure that we don't have people traveling into the province who are sick. Obviously, if somebody is not displaying symptoms and then they arrive here, that is the purpose of having people self-isolate for 14 days. We regularly turn people away from the borders who have no valid reason to come to the province. So that is happening. And again, we would like to have a clearer and tighter picture and communication around what we want to see happen moving forward. So those meetings are happening. They happened over the weekend. We have another meeting in the next 24 hours to finalize those pieces of information that we want everyone to be comfortable with in terms of what's allowed, what types of travel is allowed across the border, which is very little, and what is not. And that process right now, again, we are looking into some ways of strengthening all those pieces, again, for that very reason. We don't want the borders to be as porous as they are right now, and we certainly, again, want to protect New Brunswickers.
Thank you, Mr. Cameron. Thank you, Dr. Elizabeth Fraser, CBC.
Dr. Russell, can you discuss some of the possibilities for how a new case could be diagnosed more than 2 weeks after our last case was diagnosed?
Absolutely. There's two different ways that can happen. One, it's a travel-related case whereby they came in to the province, they weren't showing symptoms, and then within that 14-day period of traveling to the province, they then developed symptoms. So that's one way. The other way is community transmission. So community transmission would mean that there is some asymptomatic transmission perhaps in the community, or very, very mild symptoms, and so that person could contract it that way. And I think that's the most important reason that everybody needs to get tested who has symptoms right now, because that is the only way that we're going to be able to diagnose people and identify them and make sure that they self-isolate. So I encourage everybody who has even the mildest of symptoms. We have a long list on our website. I think there's about 10 symptoms, and if you have 2 of those symptoms, you will be referred for testing. So please call 811. Have a very low threshold for calling 811, because again, some people show very, very mild symptoms, and if those people who are showing very mild symptoms are then infecting others, then we could see another spike, and we wouldn't want to see that. So everybody has a responsibility to look after themselves in terms of watching for those symptoms, and even check on your friends and family. How are you feeling? If you notice them having symptoms, encourage them to get tested.
Thank you, Dr. Ms. Fraser. Do you have a quick follow-up?
Yes. If this new case was transmitted by someone who was asymptomatic or didn't self-isolate properly or for long enough or traveled in with the disease, why should consumers be confident about the reopening of businesses next week?
That's a great question, and I think it's a very appropriate and timely question, because what we know is that we will never be able to achieve and maintain 0 cases in perpetuity. So it was never our goal to have 0 in perpetuity. Our goal was always to be able to live with the virus, knowing that the population is armed with as much information and as much knowledge to protect themselves as possible, and that moving forward, that we would be able to manage the cases as they popped up and do the contact tracing and make sure people self-isolated and make sure that the healthcare system was not overwhelmed. So this is going to be a cycle that we're going to see. Some people refer to it as a dance. Some people refer to it as different waves. So we've been through our first wave. Most jurisdictions see a second wave. We might see a third and fourth wave depending on how things go. But if we are aware that this is going to be the expectation moving forward, then again, everybody is armed with that knowledge. They can protect themselves as individuals. Employers can take the proper steps to protect employees and their patrons as we move forward. So that is the type of work that has to be done to lift measures very safely and gradually.
Thank you, Ms. Fraser. Andrew Watt, Telegraph Journal.
Hi. Dr. Russell, do you have any idea how many people were on that plane? And can you tell us how this person managed to get out of New Brunswick without having to self-isolate here from us?
Well, we do have screening that's done at the airport. So we have peace officers from the Department of Public Safety that are meeting scheduled and chartered flights that are arriving in New Brunswick, in the same way that officers that are posted at the land borders at points of entry are collecting information. So air travelers are screened upon entry and they're asked questions, and then the peace officers are authorized to deny entry to people coming into New Brunswick. And if the person was identified as somebody who was infected, then follow-ups and contact tracing measures are administered. But it is possible that this person just didn't identify as somebody who had symptoms, et cetera. So again, we have screenings that are at the airport now. They started on April 25th. And I do have staff looking into, again, what information we have. And again, my understanding is the person was not staying in New Brunswick. They were traveling through. So, but again, I will be getting more information on that. I don't have all of it right now.
Thank you, Doctor. Mr. Waugh, do you have the quickest follow-up?
I do. So I see that the testing level is quite low in the last 24 hours. Are you now testing everybody who works at the airport and surrounds to see if they've been infected?
That is not in our plan right at the moment, but again, we do have, again, I'm encouraging everybody who has symptoms to get tested at this point. And also, we do have a plan moving forward to expand our surveillance because, again, we really want to keep our numbers as high as possible moving forward to make sure that our information and our data is accurate and we can have confidence in it. But also, we don't want to miss any cases. So the more people that get tested, the better.
Thank you, Mr. Waugh. Thank you, Doctor. Michel Corriveau, Radio-Canada.
Oui, bonjour. Dr. Russell, j'aimerais savoir, je comprends que vous avez répondu à quelques questions déjà en anglais, mais en français, là, à quel moment et où cette personne, celle du vol de WestJet, à quel moment et où elle a été testée et quel a été son trajet exact avant et après son vol?
Michel, je n'ai pas toute cette information maintenant. Je travaille avec mes collègues ici au Nouveau-Brunswick et aussi dans d'autres provinces pour essayer de déterminer toutes ces informations-là.
As-tu suivi, M. Corriveau?
Oui, M. McFarlane. Hier, Dr. Russell, vous avez parlé de nouvelles mesures de déconfinement plus tard cette semaine qui seraient annoncées, probablement, j'imagine, après la réunion du cabinet. Est-ce que ce sera revu avec le nouveau cas à Fredericton et est-ce qu'on peut s'attendre à une nouvelle augmentation de cas?
Je ne crois pas que les annoncements vont changer au niveau de le confinement puis les plans qu'on a pour le déconfinement parce que on sait qu'on va continuer à avoir des nouveaux cas. Ça va continuer jusqu'à temps qu'on ait un vaccin. Alors, le plan pour le déconfinement, c'était avec l'information, avec l'information que c'est vrai, on va avoir d'autres cas. Si on a trop de cas ou c'est trop de certains types de transmission qu'on verra, c'est dans ce cas-là qu'il faudra qu'on change le plan. Mais à ce moment-ci, on n'a pas des nouvelles comme ça. L'effet qu'on a un nouveau cas aujourd'hui, c'est pas quelque chose c'était quelque chose on savait que ça allait arriver et ça va continuer à arriver. Alors ça, c'est l'information que le public, les citoyens ont besoin de se rendre compte que toutes les mesures qu'on a en place maintenant et les avis au sujet au niveau de laver les mains, de rester 2 mètres entre les personnes, sortir seulement quand vous avez besoin, rester dans vos bulles de 2 ménages. Toute cette information, c'est vraiment important pendant qu'on va dans les autres phases de cette pandémie.
Merci, Docteur. Merci, Michel Corriveau. Silas Brown, Global TV.
Hi, Dr. Russell. When you talk about securing the borders, it sounds as if people coming in through the airport are already being subjected to a pretty high level of screening. Is there anything else at this point that we could really do to further screen people coming into the province through air traffic?
Well, whether it's air or land, again, we're having discussions this week on how to tighten things up even more, and even up until now, we have turned people away. The Department of Public Safety has collected data on the type of traffic we're seeing, and that is really important information for us to be reviewing right now. So the borders fall under public safety, and they have been doing an amazing job. They have been just doing excellent work with us, so I can't thank them enough. And again, we continue to depend quite a bit on them for those measures that are in place right now.
Thank you, Doctor. Mr. Brown, do you have a quick follow-up?
Yes, thank you. You said that discussions are ongoing around how exactly to tighten things, but when it comes to land borders, are certain measures, like health checks, temperature checks, those sorts of things, are those on the table for our land borders at this point?
Well, I know that, again, they have a screening process right now that really is around what is the need for you to be here in New Brunswick? Is it an essential? Are you traveling for essential reasons only? And obviously, if the reason you're traveling falls outside of that, that's what we're trying to nail down a bit more firmly in terms of here are the criteria you need to meet to get into the province. We're looking at things like pre-approval in terms of having, knowing ahead of time what paperwork you need to be able to show at the border, things like that, so that there's no surprises. So right now, again, people are being turned away, and it obviously would be nice for those people to know that would happen, and perhaps then they would choose not to travel here. But again, we really want to make sure that travel is limited to essential travel only.
Thank you, Doctor. Thank you, Mr. Brown. Rose Saint-Pierre, Radio-Canada.
Oui, Dr. Russell, on a contacté l'Agence de santé publique du Canada au sujet du cas de la personne infectée au coronavirus qui a passé par l'aéroport de Moncton. De leur côté, ils nous disent que vous avez en ce moment toutes les informations pour retracer tous les contacts que cette personne infectée-là a eus. Est-ce que, en effet, c'est les informations que vous avez en votre possession en ce moment?
Alors, les informations que j'ai maintenant, c'était produit par j'ai reçu ça le département de sécurité ici au Nouveau-Brunswick, et c'est cette information qu'on parle avec nos collègues dans les autres provinces pour déterminer l'endroit où la personne qui a été diagnostiquée avec COVID-19 est présentement.
C'est un cas qui date quand même de plusieurs jours. Là. Comment vous n'avez pas encore l'itinéraire exact de cette personne-là, ni le moment où la personne a été testée?
Tested in another province.
Peux-tu répéter la question, s'il vous plaît?
Oui, le cas date de plusieurs jours. Le moment où c'est arrivé, c'était fin avril. Comment vous expliquez qu'aujourd'hui, vous n'avez pas encore de l'information sur l'itinéraire de cette personne-là, ni de l'information sur le moment où la personne a été testée positive à la COVID?
La date de voyage, c'était le 27 avril, et l'information qu'on a reçue, c'était seulement hier. Alors, et le cas n'a pas été testé ici, dans la province de Nouveau-Brunswick. C'était quelqu'un qui était testé en hors du Nouveau-Brunswick.
Tu nous suivis, Mme Saint-Pierre?
Simplement, pourquoi est-ce que ça a pris autant de temps avant d'avoir l'information?
Je n'ai pas une réponse pour ça. Hier, c'est la journée qu'on a reçue.
Merci, Mme Saint-Pierre. Catherine Lecomte-Roussel, Frontière.
Oui, bonjour, Dr. Russell. Le nombre de cas dans l'État du Maine continue toujours de croître. Pouvez-vous nous expliquer tout d'abord clairement qui sont les gens autorisés à traverser les frontières? Parce que nous sommes conscients que des résidents du Nord-Ouest, par exemple, travaillent dans les hôpitaux et les moulins où sont répertoriés des cas de COVID-19. Donc, quelles sont finalement les mesures en vigueur pour ces travailleurs qui passent d'un pays à l'autre quotidiennement?
Alors, il y a toutes les gens qui travaillent ici au Nouveau-Brunswick chaque jour, ils ont la permission parce qu'ils sont des travailleurs essentiels. Mais toutes les autres gens qui viennent à la province, sauf que les conducteurs de camions, tous les autres gens qui viennent aux provinces devront s'isoler pendant 14 jours.
As-tu suivi, Mme Lecomte-Roussel?
Non, merci.
Merci beaucoup. Bonne journée. Shane McGee, CBC.
Hi, Dr. Russell. Is there any indication that this person who flew through Moncton, that they may have been in close contact with other people in New Brunswick, and how long they may have been in the province?
So the only information we have right now is around the flight, and so that information has been made public. So anybody who was on that flight should be self-isolating. But honestly, anybody who is coming into the province from another province or country needs to self-isolate for 14 days. And again, we are looking into the information that we did receive, so we are working with our colleagues in other jurisdictions to find out as much information as we can at this point in time. And again, because of the measures that are in place right now, most citizens are self-isolating within their 2-household bubble, and when they are going outside of that, they are maintaining a distance of 2 meters away from people. I think the other thing that I would love to highlight, actually, is that again, we are going to continue to see cases. We need everybody to understand how to protect themselves. So if you are receiving a visitor or a family member or a household member from another province and they need to self-isolate for 2 weeks, it's really better if they don't they don't stay in the same room with you. It's better if they have their own bathroom. It's better if you make sure that everything is disinfected. So if you know that someone has come from outside the province, they have to self-isolate for 14 days, and you need to protect yourself if you're in that household. And again, the way things are set up right now, everybody should be social distancing when they're outside of their household bubble, and nobody should be coming into close contact with other people. So the risk of contracting COVID in that type of setting would be lower. So again, I want New Brunswickers to feel as safe as possible with that information, knowing that you need to continue with the hand hygiene. You need to continue with wearing community facial masks. You need to continue the physical distancing. So these are the things that we need to do, and we need everybody who has symptoms to get tested. So encourage your loved ones and friends to get tested if they have even mild symptoms.
Thank you, Doctor. Mr. McGee, do you have a follow-up?
Yes, please. Dr. Russell, you mentioned you're concerned about gaps based on this airport case. What specific gaps are you concerned about, and how do you address those?
Well, I think it's around the transmission of the information, where it comes from and where it goes to, and what are the best ways to make sure that all the T's are crossed and the I's are dotted. Obviously, again, we want to protect our citizens here in New Brunswick, and so whatever information we need to have it in a timely manner, and it needs to be dealt with as soon as possible, again, to make sure that if there is anything to be done besides the public notification that we have been doing already, which we have done several times in the past, that yes, we can do that, but again, we would like to have as much information as soon as it's available so that we can, again, make sure the T's are crossed and the I's are dotted beyond what we have just done today. So again, I am hopeful that we can work on those gaps and make sure that we can get that information in a very timely way.
Thank you, Doctor. Thank you, Mr. McGee. Ross Lord, Global TV.
Thank you very much. Dr. Russell, notwithstanding the news today, you did go 16 consecutive days of no new cases. Considering how other provinces, including your neighboring provinces, are struggling, to what extent do you believe that you are at least winning this fight against the virus?
Well, again, I don't want to give anybody a false sense of security. What I'd like to say is I'm very grateful for all the work that New Brunswickers have done collectively to get us to this spot, but we do need to recognize that as we move forward in the next phases, that there could be more waves, there could be more outbreaks, and again, if we all continue to do the work that we've been doing to keep each other safe, then we can continue to have success. But I definitely understand that, you know, we are at the mercy of the fact that this virus is with us. We are at the mercy of the fact that there can be people with very, very mild symptoms out there transmitting it within the community. We know that our borders are a risk also from people coming from those provinces that are struggling. So it is really imperative that all of the information and all of the public health advice and measures that are in place are adhered to as strictly as possible. That is really the only way for us to succeed, and it really is the only way for us to live with the virus as we try to relax measures and make sure that we do that as safely as possible and as gradually as possible.
Thank you, Doctor. Mr. Lord, do you have the quickest follow-up?
I do, yes, thank you. So we've gone through a long list of possible contributing factors to your streak and also some of the, I guess, features that are inherent to the province in terms of demographics and no major international airport, et cetera, although there is an airport-related case. But what can other provinces or jurisdictions that are struggling to contain the virus learn from New Brunswick? I guess what I'm asking is how much of your success has to do with specific decisions you made and how much has to do with some of the features that are just working in your favor?
Well, firstly, I just want to say that success has to be defined in terms of your objectives. So our objectives all along when the pandemic started was, one, to be prepared, to learn as much as we could from the Public Health Agency of Canada and our other jurisdictions across the province, across the country, to make sure that we had in place everything we needed to be ready. What information did we need to be ready? And work with all of our partners across government, within the RHAs, EMP, ANB, the nursing homes, et cetera. How were we going to be prepared? What number of hospital beds and ICU beds did we need to have available if there was a surge? We had to do modeling to determine some of those pieces of information. So that collective work was enormously beneficial in terms of preparation. We have great public health teams across this province, and we did have kind of a dry run this summer with the measles outbreak in terms of ramping up for an outbreak. This is obviously on a global scale, so it's very different. We have had the benefit of having good government. We have Premier Higgs, who has, been really shown a lot of leadership with respect to the COVID-19 cabinet and bringing the other parties to the table to have the discussions, to make decisions in a timely and streamlined way. We also have the pandemic task force. So I think you have to have the structural components, you have to have the people, you have to have the knowledge, and you have to have the ability to communicate with the public in a way that's meaningful, that they can internalize and understand, and have confidence in that information and understand where to get credible information so as not to be confused by or distracted by misinformation.
Thank you, Doctor. Thank you, Mr. Lord. Adam Harris, Telegraph Journal.
Dr. Russell, with New Brunswick Department of Public Safety now screening passengers arriving at the airport, in terms of the WestJet flight, did that person get through that screening, or was that screening not in place at the time because this flight was April 27th?
I'm still working with my colleagues to find out all the details at this point in time, so I would probably have more information on that tomorrow.
Quick follow-up, Mr. Harris?
Yes, please. Dr. Russell, Prime Minister Trudeau pledged today to help industry bring in more temporary foreign workers to Canada, noting the harvest season in late summer and fall will need more workers then. There's obviously a ban in New Brunswick, but is there any scenario that you would see you recommending bringing in temporary foreign workers in New Brunswick that could be done safely?
Well, at this point in time, that's a government decision. So if the government decided to do that, my job would be to let them know how to do that safely, but I will leave that to the government.
Thank you, Mr. Harris. Vicki Hogarth, Charlotte County TV.
Thank you, Bruce. Dr. Russell, approximately how many people a day are still flying to or through New Brunswick, and do you know if they're subject to thermal screening?
I don't have the numbers of people traveling into the province from in the airports. DPS is collecting all that information, so they probably do have a good ballpark number, and I can ask them.
Follow-up, Ms. Hogarth?
No, there was two parts to her question, actually. Sorry. You asked about how many, and then the question was about screening.
Thermal.
Yes.
Are they taking temperatures?
Oh, I know they're asking questions. I'm not sure about the temperatures.
Next question, Ms. Hogarth.
Yes, thanks, Bruce. Dr. Russell, with a new case in Fredericton after 16 days of no cases, what is the likelihood that we have pockets of community spread that are just under the radar?
First of all, the case is in the Fredericton region, so I can't say specifically where in the Fredericton region, but it's in this region. And secondly, I am concerned there's community transmission, and I am concerned that people can have very, very mild symptoms, and that's why I'm encouraging everybody in this province who has 2 symptoms on our list of about 10 to get tested. That is the only way we will find cases. So that is what we need everybody in New Brunswick to know. And I encourage everybody in all parts of the province to get tested.
Thank you.
Thank you, Ms. Hogarth. Nicolas Steinbach, Radio-Canada. He's gone. Mathieu Roy-Como, l'Acadie Nouvelle.
Bonjour, Dr. Dr. Russell, on s'était parlé il y a peut-être 2 semaines du test du cube Spartan. Le Nouveau-Brunswick, je pense, avait discuté avec la compagnie, considérait peut-être utiliser ce test-là. Ça a été rappelé par Santé Canada cette semaine. Est-ce que le Nouveau-Brunswick était en train d'aller de l'avant avec l'achat de cube Spartan et puis quelles vont être les conséquences si oui?
Alors, c'est vrai qu'une couple de semaines passées, on y pensait, mais jusqu'à date, on a décidé de ne pas en acheter.
Merci, docteur. Monsieur Roy, comment as-tu un suivi?
Oui, pourriez-vous nous répéter en français, Madame Dr. Russell, le nouveau cas aujourd'hui dans la grande région de Fredericton, comment ça entre en ligne de compte dans les décisions qui doivent être prises concernant le déconfinement, les prochaines étapes de déconfinement qui ont été promises ou en tout cas desquelles on a parlé pour le restant de la semaine. Comment vous intégrez ce nouveau cas dans la prise de décision?
Oui, alors, ça veut dire que ce n'est pas une surprise qu'on a un nouveau cas. Ça ne va pas nous surprendre qu'on continuera à avoir des nouveaux cas. À avancer le déconfinement, ça va continuer quand même, sauf que s'il y avait des problèmes au niveau de le nombre de cas, le type de transmission dans un tel montant de jours. Alors, si on avance avec, fur et à mesure qu'on a des cas, on peut les gérer, on a toutes les choses en place pour avoir le système d'hôpital en place. Ça veut dire qu'on peut avancer avec le déconfinement, mais on a des mesures aussi pour nous dire s'il y a trop de cas dans un tel nombre de temps, un type de transmission qui nous inquiète, c'est ça, il faudra qu'on ralentisse ou ralentissez ou peut-être même aller par en arrière si c'est le cas. Mais on va continuer à faire beaucoup de tests, on va continuer à chercher des cas et on veut vraiment faire tout ça en sécurité et graduellement.
Merci, docteur. Merci, M. Roy-Foucault. Voilà la fin de notre mise à jour. Merci beaucoup. That concludes today's update. Thank you very much.
Length of the preceding program, we now join the regularly scheduled program already in progress.
In Nova Scotia, in that not too long ago she did something amazing, and that's Sub-Lieutenant Abigail Cowbrow. And Judy, talk about that a little bit and what she did most recently.
Well, she was only 23 years old, and little did she think when she did a tribute just a short time after the killing spree in Nova Scotia, and she was paying tribute to the 23 lives that were lost. She was on the ship and actually got her bagpipes out to do Amazing Grace and carried that out only a few days before her life was taken. It's shocking to think that she was serving her country